Hello, everyone. Thank you for tuning in to the Truth About Cholesterol webinar. My name is Kylie Quammen, and thank you for joining. So, there's usually a couple of reasons why somebody's tuning in to watch this. Either maybe you've been told that you have high cholesterol, maybe you're on a statin, or you know somebody with either of those. Today, I'm here to challenge your understanding of heart disease and give you the science and let you make your own informed decisions about your cardiovascular health. So, a little bit about me, when I started chiropractic school, I had the goal of helping people get out of pain. And throughout chiropractic school, I dove deep into, classes such as anatomy, physiology, biochem, nutrition. But I learned, chiropractic adjusting is a really powerful tool, but I learned that there's more to the story. So I learned the power of making lifestyle changes for the better, like eating habits, sleeping habits, exercise, reducing toxic substances around me. Even though I was normal and doing these healthy things before this, I still had so much to learn. So today I continuously challenge myself to explore the science, the research, deepen my understanding of everything. So I put this talk together, and it's a little bit of my backstory and how I found the Wellness Way. So when I was 18, I finally ran my first blood work. And, they're like, oh, everything looks good, except you have high LDL, high cholesterol. And heart disease was in my family. So, that scared me at the time. They said that I had a high risk of having a heart attack. And, as an 18-year-old, not many people get told that. And so, I demonized cholesterol and because I didn't understand its role in the body. And, that really startled me. But then throughout my graduate school, I found the Wellness Way. It brought me clarity and real action steps towards, healing my body, preventing heart disease to begin with, and not masking just a blood marker like LDL test to a medication without even considering my lifestyle habits or other markers that give you better information. So, with this talk, I'm not trying to sell you a magic supplement or give you medical advice. My goal is simple. I challenge you to act and think differently about your cardiovascular health. All right. So, what's the problem to begin with? So, heart disease stats are on the rise. It doesn't even discriminate between men, women, it's both. Heart disease is the number one cause of death in the US or in the world, and it just continues to keep climbing. And when we're spending how much money in the healthcare industry towards heart disease, we should be seeing a change here. So, in the news here, we see that heart disease continues to be the number one killer in both men and women. It's shameful, but when caught early, heart disease can be treated and sometimes even reversed. So, what are we missing here? So, I'm going to kind of break down a few of the principles here that kind of talk about how people handle health in regards to cardiovascular disease. So, in the medical system, typically that allopathic approach there, they treat symptoms, using drugs, whether that's some kind of statin, injection, something to bind up bile. They just do like very basic lipid testing so that, they're not really going as an advanced just because that's their training. And then we get our functional medicine. Our functional alternative medicine is more of, we're treating those symptoms with just alternative medicine instead of the medication. So maybe that's just prescribing fish oils, niacin, red yeast rice. Maybe they will run a little more advanced panels, but overall, sometimes they're just kind of throwing more stuff at you that way. And those of you that have had high cholesterol and maybe seen alternative medicine, you've probably heard of a few of these things or maybe even tried it. Well, the Wellness Way, it does things a little differently. The Wellness Way is a network health restoration clinic, and we think and act differently to solve the health challenges others cannot. And so something that we do at the Wellness Way is we do advanced cardiovascular screening. So we also ask, why is cholesterol high to begin with? If we see a high LDL marker, we're not just going to put the blame on cholesterol. We're going to look at, more advanced testing. We're going to look at other cardiovascular markers. We're going to look at other things that could be causing the body dysfunction. So maybe there's some food allergies that are hidden somewhere that you're consuming on the daily, or maybe we got to look at hormones or the gut or heavy metal consumption. So there's a lot of things that can play a role in your health that we really dive deep into understanding what's going on. So how did we get here? Why is cholesterol the bad guy? So in 1953, there was a study done where fat in the diet was said to raise cholesterol levels. And that high cholesterol is the reason for the rise in heart disease. So essentially they're just saying, oh, heart disease is, becoming more prevalent right now and people are eating more fat in the diet, so fat's to blame. And then they also looked at the caloric intake, so looking at what percentage of your diet was fat, and then compared it to different ages here in different countries. And they just showed that, we ate more fat, hence we had more heart disease, and that was the culprit. So saturated fat in the diet does result in an increase in cholesterol, but something important here, it does not cause heart disease. We actually need saturated fat in the diet, and we need healthy cholesterol levels. So in 2001, there was a study here. This one's actually a pretty good one. It was a Honolulu heart study, and they followed people for 20 years. So that's a very in-depth research article, which I really admire here. But they actually found that there was an increased mortality with those who had low serum cholesterol levels. And so that people who had long-term low cholesterol had that increased risk of heart disease and risk of death. And when they tried to summarize, why is this, they just were not able to explain their results. So in the medical world, we know that statins are used to lower cholesterol. But at the Wellness Way here, we understand that the body works as a whole. Our body is like a Swiss watch principle here. So if all of our different systems are a gear in this entire Swiss watch, nervous system in the middle being that master coordinator, if we start to throw little rocks in one area over the other, it's going to start to affect the body as a whole in every system. So there is no affecting just one system. The whole system works together. So in cholesterol production here, we've got the chain of the biochemical reactions here, but there's a few important notes I wanted to make on this. So cholesterol itself, we've got like our statin here. The statin is going to block this enzyme here, the HMG-CoA reductase, before it even gets made into cholesterol. So what it's doing is it's just stopping it from even being made to begin with. But in the process of that, when you're making cholesterol in this process, you're also making the enzyme CoQ10. And CoQ10 is actually an important enzyme that's responsible for energy production. It helps make ATP. It's a strong antioxidant and helps protect cells from damage. It's really researched and stressed that we need CoQ10 for our heart to be healthy and, our nervous system as well. So just blocking the production of CoQ10 to begin with can be a very dangerous approach. So if, someone is on a statin, it's really important that you may have even heard this nowadays that you need to be on CoQ10 just because of the way it's reducing its production as well. So something else that's important to mention is that statins, they actually inhibit liver function as well. So I don't know if you've ever seen the long list of side effects, but this is from the PDR. So this is where physicians go to see all the reactions and stuff that may occur based on one drug. And here I've got two different drugs up here with their severe, moderate, and mild categories of side effects. And some of them are a little scary. So like being, just different pain, myasthenia gravis, so like weakening of the face, hepatic failure, so liver failure, delayed onset diabetes, headaches, nausea, dizziness, abdominal pain, fatigue. So a lot of these are actually common ones we see with chiropractic too. So it's important for us to know, like if someone's on a medication that could be causing this, why you're getting that fatigue and the muscle pain and joint pain to begin with. So it's important to make sure that you understand everything going on there when it comes to each medication you're taking. And then on the bottom right here, we can see these are some examples of cholesterol medications that you may have seen. So if you understand what statins do and your doctor's telling you you have to take a statin so that way you don't die of a heart attack or stroke, does it at least help your chances of staying alive? So here I'm going to break down some of the research that talks about the risks analysis from research. So one of the first ones here, 1984 lipid trial here. So this one was talking about how the drug cholestyramine prevents the reabsorption of cholesterol from the digestive system. So there were actually a lot of side effects from this one because when you're affecting the digestive system, you're really affecting the whole body. And some of the side effects were kind of nasty. Like one of them was anal leakage. And I don't know about you, but I really would not like that one. But this was its trial on relative risk versus absolute risk. So here on the left, you can see that the cardiovascular heart attack here, how many people died from having a heart attack with or without. So either they were given a placebo or they were given this cholestyramine. And what you can see here is there's actually only a 0.4% absolute risk when you're comparing the numbers. But then what the research articles do to kind of exaggerate the effectiveness is they calculate relative risk. And that's a probability number used to really make it look better, honestly. So 24% was that relative risk they calculated, when in reality it was only 0.4%. So the result is everybody was told to be on a low cholesterol, low fat diet. So then they did the study on Lipitor. That one's a really common one nowadays, but it's really powerful to reduce the liver's ability to produce cholesterol to begin with. And in this one, they found that, you can even read it here on the article, that in patients with multiple risk factors for heart disease, Lipitor reduces the risk of heart attack by 36%. So this is that absolute risk statistic versus relative risk again. So that meant in a large clinical study, only 3% taking the sugar pill died, as opposed to 2% taking the statin. So in reality, when we compare the stats there, that's actually only a 1% absolute risk. 1%. So if we're having a 36% relative risk, again, that's a play on numbers, that probability number, and comparing it to those who had a heart attack with absolute risk, the difference was 1%, just 1. And then you read the warning label, and Lipitor is a prescription drug used with diet to lower cholesterol. Lipitor is not for everyone, including those with liver problems, liver disease, women who are nursing, pregnant, or may become pregnant. So that's also important when they're talking about preventative statins in young women. So this, affecting their chances of becoming pregnant potentially. But so Lipitor has not been shown to prevent heart disease or heart attacks. So that right there is a powerful statement. So then we have another article here. So 2008, there was a Jupiter trial done on Crestor. And Crestor here is one of those really strong ones that are prescribed nowadays. But in the results here, the difference was so small when comparing that absolute risk that they had to zoom in the chart to be able to see the difference between the placebo and the robustatin. So that just kind of goes to show that they really have to blow up their numbers to make their point. And this is that warning label for Crestor. So Crestor is prescribed along with diet again. So for lowering high cholesterol, it has not been determined to prevent heart disease or heart attacks or strokes. Crestor is not right for everyone. So one of the books that I really recommend everyone read if they're on the border between, high cholesterol and what they should do about it. So this book here, The Great Cholesterol Myth, is wrote by Dr. Johnny Bowden, PhD, and Steven Sinatra, MD. But what they do is they challenge that conventional belief that high cholesterol is the primary reason for heart disease, when instead they argue that factors like chronic inflammation, oxidation, poor dietary choices, and they even break down all that research on statins again. So I think that's a really important resource to have if you're, wondering and wanting to really dive into the research behind it and make your own informed decision. So how do we fix it? How do we fix this issue? So before we fix it, we should probably figure out what cholesterol's role is in the body. So cholesterol here, described by WebMD, cholesterol is an important type of fat made in the body, and it's needed for body function. It is also found in foods that are made from animal products, meat, and dairy. Okay. Where does it come from? So the body actually makes most of your cholesterol. And it's usually made in the liver. Diet and exercise only correlate about 10 to 20% of it. So your body's responding and producing the cholesterol for a reason. Your body is making that 80% of it. So now I'm going to break down a few of the reasons of, what cholesterol does in the body. So cholesterol is a vital component of the cell membrane. So every cell in the body has this phospholipid bilayer and has the cholesterol backbone. And it's a very strong healing molecule. We need this to heal any kind of cells. So what were to happen to cholesterol levels if you cut your finger? Well, if you cut your finger, your body's going to try to heal, and it takes more cholesterol to heal. Cholesterol actually has an importance in brain function and memory here. So There was a research study done here from WashU in St. Louis that the brain represents only about 2% of the body weight, right? But it has 20% of your body's cholesterol. So that's a high number of cholesterol going to the brain. Your brain feeds off fats like this. So when cholesterol is found in large amounts of brain tissue where it's needed for normal brain function, and it's showing now that research is showing that cholesterol is so vital for older people whose memory may be declining. They found that high total cholesterol levels later in life are associated with reduced risk of dementia. So infants actually need lots of cholesterol for proper brain development. Cholesterol is normally found in large amounts in the human breast milk. And today we're seeing still some issues when we look at infant formulas. They typically contain little to no cholesterol because of that widespread lack of understanding about it. Another one here, so cholesterol is really important for nerve function. Cholesterol is vital because it helps surround the nerve. So the myelin membrane around each nerve is mostly fat and cholesterol. And these brain synapses in the nervous system here, they are also made of almost entirely cholesterol. So just reducing cholesterol is also going to affect a lot of other things in the body here. And then one really big one here too is cholesterol is really important for the making of vitamin D in your body. So vitamin D, most people are like, oh yes, I go out in the sun, I get my vitamin D. But vitamin D is made from cholesterol in the skin. So we actually need cholesterol to be able to make it to begin with. So cholesterol is needed in the skin, and lower cholesterol levels will prevent your body to be able to make a sufficient amount of vitamin D. So cholesterol is also really important in digestion. So cholesterol is converted into bile salts in the liver, which are needed to break down and emulsify fats. So you actually need that cholesterol there to be able to break down fats and properly absorb them in the diet. But most of those bile salts and stuff I was talking about are made from cholesterol, and they get stored in that gallbladder and then used from the gallbladder for digestion. So cholesterol is also super important when it comes to stress. So when we look at hormone production, cholesterol is actually the top of the chain when making your steroid hormones. So when we look at this chart here, this is our hormone chart, and here up at the top we have cholesterol. So cholesterol, think of this like a waterfall. We're feeding all these hormones with cholesterol being that backbone. So we make pregnenolone, progesterone, all the way down to cortisol. Cortisol is that stress hormone. So we actually need cholesterol to have that stress hormone in our body. And then cholesterol also makes DHEA, testosterone, estrogens. So all these important ones that we need in our body to have that normal physiology, we need cholesterol to make these. So I challenge you that the goal should never be just to lower cholesterol, because this can make you sick. So if cholesterol is so good, then why does it get so demonized? So this might kind of sound a little like a smart aleck, but do firemen cause fires? So if we have the same amount of fires going on in the world, just by reducing the amount of firemen, is that going to reduce the fires? No. So cholesterol is acting like that fireman. He comes in, he tries to heal, he tries to repair things. He's trying to put out the fire. Same with the analogy, do police cause the crime? Just because we have less police doesn't mean there's less crime. So same thing with cholesterol there. So it all starts with inflammation. And what is inflammation? Inflammation is that process for which your body's immune system and tries to protect you from injury, infection, things like that. So it's your body's response to trying to protect yourself. So I'm going to kind of dive in here. So this is that vascular endothelium. So what this means is when you look at an artery, it's actually only got one cell layer deep from where the point of contact with your blood and your artery is. And this does a lot of things. It's your barrier, it's your immune system, it's your blood pressure regulator. It, produces the nitric oxide, which is important for the artery to dilate. So a lot of that affecting your blood pressure and everything going through it. So we're going to break down the plaque cascade that has been shown to lead to that atherosclerosis this here and the clotting mechanism. So here's a video that's going to play.
Atherosclerosis is a condition characterized by the buildup of plaques, which are made up of fat, cholesterol, and other substances in the walls of arteries. Atherosclerotic plaque formation begins with a small injury to the endothelium, often caused by hypertension, high cholesterol, high blood sugar, or smoking. This allows cholesterol to migrate into the thickness of the vessel wall. Cholesterol is converted to an oxidized form as a result of a series of biochemical reactions, which is an inflammatory signal to blood cells. Monocytes, which normally move freely in the bloodstream, migrate to the vessel wall and transform into macrophages, which begin to actively absorb cholesterol molecules. As a result of this process, they turn into large foam cells. As the foam cells become saturated with large amounts of cholesterol, they die and release their contents. Thus, cellular detritus, large numbers of foamy macrophages, collagen fibers, and cholesterol crystals form the bulk of the atherosclerotic plaque. Smooth muscle cells transform into fibroblasts and migrate to the top of the plaque, helping to stabilize its cap. The process of forming an atherosclerotic plaque is usually long and takes years. As a result, this process narrows and hardens the arteries, leading to reduced blood flow and can result in serious health issues. In the case of the carotid artery, one of the most serious complications is acute cerebrovascular accident.
All right, so I want to break down the difference between LDL and HDL. So typically we hear LDL is the bad cholesterol molecule, HDL is a good cholesterol molecule. I'm not here to say that either is either or of those. LDL, what this means here is it's the protein carrier of cholesterol. So LDL has, its fat molecule inside it, that cholesterol molecule, but it also has protein. So it's a lipoprotein and it delivers things to the cells. So LDL is that one that leaves the liver and goes out to the body, whether it's making hormones, healing, all these other things. But HDL is the one that comes back to the liver, hence why they call it the good one, because it's taking that cholesterol out of the blood and bringing it back to the liver to be recirculated. And HDL is actually mostly protein and less fat. So when you look at a basic lipid panel and it just has LDL and HDL and that total mass, that's really telling you nothing about risk. It's just telling you your number on a scale. Whether that's, having 130 LDL and 50 HDL or 100 LDL and 80 HDL, it's really not telling you much what's going on. So here's another article done in 2008 about LDL and heart attacks. So what they did when they did this research article is they measured LDL in people who had had a heart attack. And what they found is half of them had high LDL, half of them had low LDL. So what they found is, it didn't matter where their LDL was, they still had a heart attack. So something I want to mention here when it comes to that endothelial layer and that particle size really does matter. Particle size is more important than just the number of lipid molecules. So this tells you, will it get through the endothelium? So I want you to think of the endothelium like a tennis net. And our tennis net is meant to keep out tennis balls as we hit them into the net. Well, the same thing goes with cholesterol molecules. The bigger, the fluffier, the easier they stay out. But as soon as you start to have those small, dense particles, think like golf balls, they're going to be able to get through that lining a little easier and accumulate in that plaque development. So something also really important here is statins, they do not actually affect the particle size. They only affect the total production of the body is making, so your total cholesterol production. So how do we fix this issue? So first off, we got to start by addressing the inflammation. What's going on in the body? What's causing that damage in that endothelial lining to begin with to cause this plaque cascade? So at the Wellness Way, we look at, how inflammation is the foundation for all disease, whether that's diabetes, thyroid issues, cancer, infertility, autoimmune, hormone imbalances. So we understand that inflammation is the root of all disease, and we have to approach it from that perspective. So what causes inflammation? Inflammation is caused by 3 different types of stressors. So we've got our physical stress, trauma, our emotional stress, thoughts, and our chemical stress, toxins. And so ways that we can address those are physical stress, whether that be car accidents or posture every day, things that we're doing with our body. How are we recovering from our exercise habits? So that'll be something there. And then we also have our toxins. So whether that be food allergies, there's a lot of hidden food allergies that we don't even know about until you get that tested. And then we've got our environmental stuff, our water quality, our air quality, what kind of food we're putting in our body every day. And then we also have our thoughts, so making sure that you're addressing that emotional component is really important. So where do we go from here? So like I mentioned earlier, your body acts like a Swiss watch. So when one gear is turning a little slower than the other, it's going to affect the rest of the body. So we really have to address the body as a whole and not just one little system at a time. We also need to make sure we're addressing those stressors, like I just mentioned before, not just physical, not just chemical. We need to look at all three: physical, chemical, and emotional. You need to make sure you have the right people on your team and products. So whether that's, emotional here, whether you have, your mental health therapist, or it's a business coach, if your business is stressing you out, or finances, are chemical. So making sure we're using toxin-free skincare products and household, products that with reputable companies that are toxin-free, organic, certified. Food education professional, that can be really helpful in trying to decide how your eating habits can improve. And then one really important one is having a physician that doubles as a lifestyle coach. So not someone that's just going to give you some magic supplement or pill and tell you it's going to go away eventually, or that you have to take it the rest of your life. You need someone that can also be there to kind of guide you through lifestyle change, so that way you don't have to rely on that pill or supplement the rest of your life. And then physical. So this one can be, chiropractic care, rehab specialists, physical therapy, occupational therapy, having a personal trainer, group fit instructor, gym membership, keeping your physical health in line that way. So something that I find really important is change your habits, change your life. So eating quality organic foods, so consuming, adequate protein, making sure it's, grass-fed, grass-finished for the highest quality consumption, wild-caught fish, organic beans, bone broth, free-range antibiotic-free poultry, meats, eggs, high-fat substances that are like coconut, avocado, nuts, so like the good fats that we talk about, grass-fed butter, wild-caught fish, a lot of those organ meats and everything also have fat in it. And then making sure you're eating the rainbow when it comes to vegetables. You should be having, at least 3 cups of vegetables a day, and opting for that organic again, just making sure pesticide-free and everything. So again, changing your habits, changing your life, you have to develop a healthy relationship with daily movement and exercise. So you can get our free exercise guide. We do have one of those in the office. We can email that out to you. But building lean muscle mass is so important. It resets your metabolism, really. So frequent movement throughout the day. Digestive walks is something that we incorporate in our office. So eating something and then going for like a 10-minute walk after, just to, calm the nervous system, be able to digest, and then you're also moving around. And then on the right here, you can see the American Heart Association, their recommendations of getting at least 150 minutes of exercise a day. So then there's also something to say about, female hormones and exercise habits. So us women, we're not the same every day. If you had a 28-day cycle, your hormones are constantly fluctuating. So it's really important to guide your exercise with your hormones and not against them. So that's another conversation. If you want to catch our hormone masterclass, that'll be posted here soon. That one really dives deep into that. And then here we got another one: balance your cortisol and circadian rhythm. So this one really helps with sleep habits too, but getting that morning sunshine or looking at the evening sunset helps really balance that circadian rhythm and naturally wake up and get sleepy at the right times of the day. Making sure you're eating food before you're drinking any kind of caffeine. That'll really affect your cortisol. And then looking at exercise habits with your hormone levels too. So if your hormones are higher in the morning, or your cortisol is higher in the morning, that's when you really should be working out. So making sure too, when it comes to sleep habits, men, you need at least that 7 to 9 hours. Women, 8 to 10. So yes, women do need more sleep than men when it comes to having that time to heal and repair, especially when it comes to hormone health. And then also looking at, that physical component of sleep. So whether it's your sleep posture, how are you sleeping with your neck and your back? Are you on your stomach? How's your jaw positioned? Are you breathing right? Are you snoring? Do you have sleep apnea? So there's a lot of things there that we should look into as well when it comes to lifestyle coaching. Another really important thing that we really start with is getting a comprehensive baseline. So not just getting the basic lipid panel done, we're talking about advanced here. So we're looking at, right, our LDL, HDL, we're looking at a plaque marker, we're looking at CRP. That small dense LDL is a really important marker when looking at what can penetrate that endothelial lining and cause some of that damage there. Homocysteine, so that one's a really important one at looking at vascular damage. Lipoprotein A, and there's so many more here too that I may not even have pictured. We have a couple of other ones too, our Cardio Pro Advanced or Plus. That's just a list of all the things we run, but we want a very comprehensive baseline so we know what we're dealing with when we're making those lifestyle changes, and if we need to get you to more help and stuff. But anyways, another one that we recommend people do, we refer for a calcium score test. So this one helps look at how much calcium is building up in the arteries and can really give us that idea of your risk as well. So wellness way approach here is we tag team with a lot of different things. So we do chiropractic care. We look at nutrition habits, exercise habits, your stress levels, stressors. Are you detoxing? How are your hormones balanced? We really look at a lot of things there. And something really important here is we want to determine the root cause of your inflammation. So here are a bunch of different labs and stuff of mine, actually. But one of the first ones we do on our new patient exam is an x-ray. And in that bottom left corner, we see x-ray. We see all these black bubbles and stuff. But this is one way we can really look at how much inflammation do we have in the GI system right away. And then we look at food allergies. So all these food allergies here are like those hidden ones that I didn't even know I was having reactions to until having this blood test done, and it was showing me that I was having a reaction to it every time I eat them. We've got a stool test here. This one really breaks down, inflammation. Is there imbalance in the gut microbiome? So there's a lot of things there that tests for that gives us really quality information to figure out what else could be stressing out the body. We look at hormones, your cortisol patterns, your estrogens, testosterones. We look at it all in the blood work too. We look at nutrition evals, mycotoxin tests. We really try to figure out what's causing that inflammation to begin with. So now that you're listening, what do you do now? So we challenge you to think and act differently when it comes to cardiovascular health. So thank you for watching, and then stay in the know. So we've got all kinds of resources here for you guys. We've got some great Facebook groups with lots of good recommendations, and we've got our providers here always posting really quality educational information. So make sure to give us a follow, and thank you for watching.